Authorities in the UK are considering even stricter lockdown rules as the country's health secretary is warning of very serious pressure on hospitals. Ministers are concerned that strict lockdown rules are not being adhered to as closely as during the first lockdown back in March of last year. They say this could be as a result of both public fatigue but also a false sense of security that the vaccination rollout is providing. Well, let's go to London to find out more, to speak to our correspondent Tig Enright. Tig, a very good morning to you. England is only a few days into now the third lockdown. Ministers are concerned that people aren't really following the rules. So what options are they looking at?
Hi, Rosie. Good morning. First and foremost, what people here are being told is to follow the current restrictions more diligently, counteracting, as you just mentioned there, that false sense of security which could come from the rollout of the vaccination programme. We've been hearing from England's chief medical officer this morning, who was echoing the message of the German Chancellor Angela Merkel, pointing out that the next few weeks will be the hardest of the pandemic. But there are several ideas in circulation about how the government here could tighten restrictions, as the Health Secretary Matt Hancock alluded to. One idea is perhaps eliminating the rule which actually allows you to meet an adult from another household to take some exercise. There's some sense that that is being abused. Also ideas about enforcing, tougher enforcement of the wearing of masks in offices and actual enforcement of one-way systems in shops, for example. Those arrows in the floor, which I think many people would admit they can see are not being diligently followed. The main opposition party, Labour, has suggested that preschools should be closed down because they haven't. They've been allowed to remain open while other schools have been. Here in London, in the capital, the latest statistics are pretty alarming. 1 in 30 people, it's estimated, have the virus here. And the message from authorities is to everyone is to act as if you have the virus to prevent transmission.
So when we look at those numbers, the high numbers of daily new infections, 1 in 30 in the capital supposedly having it, what's the impact, what's the knock-on effect of the hospitals? What are they looking like in terms of capacity?
Well, here in London, before the weekend started, the mayor declared a major incident. Such was the pressure that there have been on hospitals. Now, the very latest figures are weekend figures, and they don't always account for the severity of the situation because of the backlog and reporting that can happen at the weekend. But on Friday, the numbers were at record levels. 68,000 new infections identified and 1,300 deaths. The former Health Secretary, Jeremy Hunt, warning that there is a 50-50 chance over the next few weeks that the NHS, the National Health Service here, could have to start rationing critical care. So it very much feels like the optimism of the new year is very much dimmed as we head deeper into it. But this all does coincide with the rollout of the mass vaccination programme. It has been getting underway in recent weeks, but this week it is expected to gather some steam. The first of the major vaccination centres, these disused conference and sports facilities which are being co-opted into vaccination centres, are opening today. There'll be more doctor surgeries and pharmacies getting involved in the effort. The latest forecast, though, is that while the government wants to have reached its top 4 priority groups, that's basically healthcare workers and anyone over the age of 70 and the clinically vulnerable, by the middle of February, that it could take until the autumn to ensure that everybody who wants a vaccine will be able to have had one. Rosie?
Tig, thank you very much. Our correspondent there in London.